Hi guys, how are you? I posted my septoplasty, uh, issues that I was having with my nostrils being clogged, absolutely to the extent where I was not able to breathe through this particular nostril of mine, and I was able to breathe through this nostril. So this area was always fine. So I just decided to post this particular video only to just to explain to people that how the procedure went and how that changed my life. So first things first, the procedure is literally zero pain. So you wouldn't feel any pain. But to be fair, there would be some discomfort. A couple of things you can expect. Number one is that you will have a very dry mouth when you wake up, and that will and you because of general anesthesia you will have a headache. So it was like somebody had operated on my head instead of my nose. So I had a pretty bad headache, but my mouth was pretty dry. And the third thing, and most importantly, is that you're gonna have this bandage on your nose, so you wouldn't be able to breathe for a couple of days, and that will get you pretty cranky for at least 24 to 48 hours. You do get used to the band-aid on the third day. For example, if you have to get it removed on the fourth day, usually it is removed in 3 to 4 days, depending on what your surgeon assesses. Always go for a qualified surgeon. Don't go for amateurs. Don't save $5,000 or whatever. I mean, in my case, the entire procedure costed me 40,000 Pak rupees. I got the procedure done around about 3.5, 4 years back. And I just wanted to share the results with you guys. You guys have seen the septum, so I'll just share the results with you. Let me just turn on my flashlight here. Yep, there you go. All right. So here's my nose now. I'm gonna close the flashlight now. So as you can see that I was able to um, I mean, the doc was able to, my septum was absolutely clubbed with my nostril on this side, but the doc was able to move it on this side to the extent, and he had to remove some part of it and then move the septum a little bit as well. Remember that septoplasty will not completely straighten your septum because septum is made up of tricky cartilage, and that the same material which your ear is made up of. There is some elasticity in the material, and that material is so tricky that you just cannot trim the material or just let it out. So you're gonna have a little bit of problem with that, but don't worry. A good doctor would be able to clear the passage to the extent that you'll be able to breathe. So nobody wants. I mean, you nobody cares if you have a straight septum or not, as long as you're able to breathe fine, and that was the entire point of the surgery. So I was able to breathe fine. um, so there is that. So don't worry about post-operative pain. There is literally no pain. I mean, I have felt no pain in my nose. So there was no post-operative pain, and now I'm able to breathe through both nostrils. I'm able to work out better. I've been able to go to the gym on a regular basis, and my workout intensity has increased. I was in pretty bad shape, and most of all, I was not able to concentrate at that point. So whatever I used to read, I used to lose track of what I'm reading, or I used to lose track of what I'm thinking. Reason being that I just had a blocked nose, and that did not help me concentrate. So here I am doing fine, um, and I just got up and I left. I mean, I struggled taking this decision 15 years late in my life. I could have gotten this surgery when I was 20, but I got it done when I was 35. I'm 41 right now, so um, You can imagine that the last 5 years of my life have been pretty cool. I got it done when I was 35, 36. I'm wrong. I don't remember. But I'm 41 right now, and you can see that I look fine. I don't have an issue. I got a clear nose. Um, and more, one more thing is that your nose from the outside, sometimes it can be dented like over here, but that the doctor was able to reduce the dent to the extent that if I don't tell you that I have a dent on my nose, you wouldn't even know. You would find a perfectly straight nose. But so if you're, for example, if your nose is a little crooked on the outside, that's okay. Don't worry about it. Um, if you can always ask a doctor to combine septoplasty with rhinoplasty, and I did that as well, but my doc said that rhinoplasty is like really drilling into the nose, and it's pretty bloody. So Pakistani doctors usually don't club septoplasty with rhinoplasty, although I've read a lot online where people do septorhino at the same time. So I don't know which country you're from, but depending, if I'm from Pakistan, so here doctors are very reluctant to go for both procedures at the same time. But septoplasty alone would be able to clear some congenital defect on the outside as well, if there is one. So just wanted to share that. But get the surgery done. Enjoy the quality of life that you deserve. Don't back off because of the pain or because you're going to get general anesthesia and whatnot. So by the way, they inject the anesthesia over here on this side, right? So it's not like it's not an intramuscular injection. It's an intravenous injection as an IV. So you wouldn't even feel the anesthesia going in, and practically you'll feel like you're going into a deep sleep, and you're gonna wake up and you'll be fine. So get the surgery done. I'm a happy person today in terms of, I mean, there's a lot happening in my life, but I'm a happy person because I'm able to breathe. I have the liberty to breathe, and therefore face whatever is ahead of me. Had I gotten the surgery earlier in my life, I would have probably been far better off, applied for a better job. I would have been a better student. I would have been a better, generally better in academics, but because of a deviated septum, I just was not able to be that competitive. Reason being that I was always losing concentration, and it was so frustrating that I used to use what do you call a cotton bud, and I used to stick it on my nose, like so that I can, move it like this, lure my nostrils, only so that I could clear the passage. But now I don't need any cotton buds. I used to use these very expensive nasal strips called Breathe Right. I don't need any Breathe Right, and I remember chasing pharmacies to get this Breathe Right nasal strip, only so that I could breathe right. But I don't need the nasal strip anymore. So I'm doing fucking awesome, man. I just think that you guys should go, guys and girls, just go ahead and get the surgery done. If you need anything else, if you have any questions, please do post it in the comment section below, and I would be happy to answer you guys. Um, and I would like to, if you want, I can walk you through the process of people out there who are still in the process of contemplating whether to go for the surgery or not. Last thing I want to mention, they say it's a pretty bloody surgery and a lot of blood comes out and whatnot. That's all bullshit. It's not a bloody surgery. I didn't even vomit after the surgery. There was a little bit of blood in my stomach. I don't know. I'm not sure. I can't see the inside of my stomach, but I never vomited, and there was no blood. After the surgery, what's going to happen is that I've already mentioned the three major discomforts that you'll have. The fourth one, I wouldn't say is discomfort, but it's something that you'll have to snort your nose. You'll have to go in the washroom, and you have to clean your nose with water and whatnot. So you gotta keep doing that, and you gotta like snort your nose, and a lot of shit is gonna come out of your nose. Don't get freaked out if that happens. It's part and parcel of the procedure. Don't spend your nights using a torch and looking into your nose, so what's happening in my nose and whatnot. Just have faith in the doctor, have faith in the procedure. It's a fairly simple procedure. Even general surgeons do it. So just don't worry about post-operative complications, or the doctor is going to twist your nose and whatnot. I did read a few comments where people said that their septoplasty did not make a difference to their life. So you first of all you need to understand, first things first. whether you are a candidate for septoplasty or not. Maybe you have something which is called an inflated turbinate, so you don't need a septoplasty, or maybe you have polyps, or maybe you have what you call chronic rhinitis. Now, rhinitis is basically inflation of your nasal mucosa, and that thing remains. So you can use a decongestion, like I use Zynosine. I'll show you. I use this Zynosine over here, and I just shake it a little bit, and I just put it in my nose. I pull up my nostril like this, and I just push it. I've already taken it, so I'm not going to do it right now. But I just push it, and the spray goes inside, and it takes effect in about 5 minutes, and it stays there for maybe 4 to 5 hours. I'm not using Zynosine nowadays because I don't even feel like using it. Sometimes there's a need to use Zynosine, so I need it for my left nostril and not for my right nostril. I just want to repeat, I got the Septo on my right, but I still use Zynosine on my left nostril. But I don't need it for my right nostril, so it doesn't. I don't, no matter what happens, my nostril is open at all times. So, I'm pretty, just go for the surgery, and I'm sure that you'll do fine. Uh, you will probably don't expect the unexpected. So, for example, if you snore in the night, and if the doc says that you'll stop snoring, that may or may not happen. So you got to be careful. You may snore because of other reasons. Um, you could be overweight and you snore because of that, or it could be heredity or something else. So don't think the septoplasty is going to take care of the snoring part, but it's definitely going to take care of the breathing part. It may or may not take care of the rhinitis part. So if you have chronic rhinitis, which is inflation of the mucosa, you can just insert the Zynosine, and pretty much clear the nose. So I hope my video was helpful for you guys. I'm gonna post it, and you can put in comments if you like. Take care. Ciao.